So I think a lot of people look to get support elsewhere, including myself. I turn more to charities, or you have mutual aid groups, or so there could be challenges early on, even getting food, medication, kind of getting support. And I think, like, for me, I missed a lot of the face-to-face peer support groups, and I know that quite a few people that perhaps were involved in some of the interviews in the network, or even people that were in the co-production group, I think missed some of that, being able to, and even being able to see each other.
I think one thing is it's exposed the social inequalities that were already present and a big impact on mental health. And so people who are living with mental health problems are often affected by other forms of inequality, like socioeconomic, related to ethnic background, migrant status, sexuality, and generally the COVID impact was greater on people who are already experiencing these things. So the need for societal change, really, as well as for community initiatives to address these inequalities and their consequences, is still greater and very relevant for mental health. We sometimes, even if there is greater social cohesion in response to it, as there was maybe in some neighbourhoods, it doesn't always include people who are living with severe conditions that may be stigmatised, or people who already tend to be marginalised. So I think while some people felt included by the sort of community coming together that Jackie's talking about, others really didn't. And so when you draw communities together, you need to think specifically about the sort of people who tend to be marginalised anyway.